I'm Rafael Schmulevich. I'm a cardiologist, an interventional cardiologist at Trinity Medical Center. I've been with Trinity for 30 years. I'm currently the director of the cardiac catheterization lab. I would like to talk to you today about chest pain and coronary artery disease. Chest pain is one of the most common symptoms from coronary artery disease. Patients come to the emergency room many times complaining of chest pains. It's our job there to determine if it is a life-threatening chest pain or not. Life-threatening chest pains are usually cardiac or pulmonary in etiology. From the cardiac point of view, usually the chest pain is described as a pressure, tightness, squeezing, burning, fullness sensation, usually in the chest, in the retrosternal area, sometimes with radiation to the left arm, sometimes with radiation to the neck and jaw. That usually occurs with activity and goes away with rest. That would be the description of chest pain due to blockages in the arteries of the heart. And the medical term for that, it's called angina or angina pectoris. When patients have those symptoms, mainly exertional symptoms of that discomfort with activity that goes away with rest, that tells us that there is a very high probability that the patient has some kind of blockages in the arteries of the heart. Blockages in the arteries of the heart are caused by a plaque of cholesterol. It's a buildup of cholesterol plaque in the inner part of the artery that blocks the blood flow into the artery. And when patients usually exercise, the heart needs more blood. That's why when patients exercise or do something that requires more energy, more exertion, then there is more need of blood into the heart, and if there is a blockage, then that's manifested sometimes with chest pain. Now, not all the time patients have chest pain. Sometimes they have shortness of breath. Women, sometimes they don't follow the textbook description of hard chest pain, and sometimes they don't have any chest pain. They have shortness of breath, they have fatigue, they have weakness, they have nausea as manifestations of blockages in the arteries of the heart. So lately we are more attuned into women presenting to the hospital with those symptoms, because that could be a manifestation of coronary artery disease. Now, it's important to recognize these symptoms, because when the symptoms don't go away and they stay for several minutes, it's important to get into the emergency room as fast as possible, because we usually say time is money. In this case, time is muscle, heart muscle. The sooner patients get into the emergency room and seek attention when they have these symptoms, the sooner we can act upon that and try to relieve that blockage, usually with balloons that's called angioplasty, or with stents, and save some patients from having heart damage. So when patients come to the hospital and they think that they may be having a heart attack, it's crucial to come to the hospital within an hour if possible. So we usually activate the cath lab team, take the patients into the cath lab, and try to figure out if they have any significant blockage that we need to act upon, as I said, mainly with what we call balloon angioplasty or coronary stents. The risk factors to develop coronary artery disease or blockages in the arteries of the heart are several, mainly high blood pressure or hypertension, diabetes, smoking, high cholesterol, and a family history of heart disease. So the more risk factors patients have, the more likely, or the higher the risk of having significant blockages in the arteries of the heart. Do not discard the chest pains. Pay attention to your symptoms. Try to get to see a doctor, and if you're having severe symptoms, then try to come to the emergency room as soon as possible, so we can determine if this is a life-threatening situation or not. And remember, healthy hearts love longer.